This procedure can be found under vascular access tunnel central venous catheters, maintenance, and management. This video is intended to be used as a review for nurses competent in repairing tunnel lines. Before repairing a tunnel line, it is important to review the procedure. Scrub the hub with alcohol wipes for 15 seconds and allow to dry for 15 seconds. And then flush your catheter with normal saline to check for any holes or leaking. If the catheter has not been heparinized after you discovered the leak, go ahead and instill the appropriate amount into the catheter. Measure the length of the catheter from insertion site to the broken segment to make sure you have at least 5 centimeters of catheter in order to successfully perform the repair. Identify the type and size of the catheter. You must have an identical repair kit. You may order the repair kit by using the ESI number found in Appendix B. When you discover the leak in the catheter, be sure to clamp it immediately, scrub the broken area with chlorhexidine, allow it to dry, and then place an occlusive dressing over it. The patient will need to remain still for the procedure, so consider the need for an anxiolytic. If the break is discovered during normal vascular access department business hours, enter a consult for the repair. If the break is discovered after hours, contact the nurse manager or house supervisor. Discuss the procedure with the family and emphasize that the child will need to hold still during the procedure to maintain asepsis. Consider the need for a child life specialist. This procedure will require 2 personnel. Don mask. Connect the needleless connector to the repair piece and flush. Make sure that the repair kit is free of any leaks, and loosen the sleeve by moving it up and down on the catheter. You may even wet it with normal saline to decrease friction. Repairing of a tunnel line, begin by identifying where the leak is. Clean above the leak using 2 chloroprop on the catheter. Apply sterile towels. Cut the catheter at a 90-degree angle. Prime the connecting piece with normal saline. Loosen the sleeve. If you're repairing a multi-lumen catheter, match the stem side size with the lumen size. One is larger than the other. Remove the clamp. Inject glue into the opening between the joints of the catheter and the repair kit. Push the catheter and the repair piece together. Slide the sleeve over the repair area and inject more of the glue into the sleeve, being careful not to puncture the catheter. Inject enough glue until you see a small amount oozing out of either end of the sleeve. Wipe any excess glue off. If leaking is noted, make sure the joints are together and add more glue if necessary. If the leaking persists, contact the healthcare provider and you may repeat the procedure. If the catheter is a dual lumen, make sure that the correct stent has been placed into the correct lumen of the catheter. If you are unable to flush, check to make sure all clamps are open and that there are no kinks in the tubing. Do not flush against resistance, as the excess pressure will cause the repaired catheter come off the catheter itself. If thrombotic occlusion is suspected, you may attempt to instill TPA after 4 hours. This time frame allows the glue to dry. With a healthcare provider's order, you may repeat the TPA 1 time. Proceed to applying your routine dressing. Apply skin protectant. Place a bio patch over the insertion site. Stabilize the joint, new repair to the catheter, with a small padded board. This provides support for the connection until The cement completely dries. Add additional tape to anchor the repair to the patient's body. Label "Do not use" for 4 hours minimum. And follow up with flushing of heparin. Instill the normal amount of heparin as required. Clamp the catheter off. Document the lot number on the repair kit and expiration date and all other pertinent data, including instructions to the family, the patency of the catheter, the outcome of repair, and the time when the catheter may be used. Remove gloves and perform hand hygiene.